Hi, Dr. McCarthy here, and I want to welcome you to Migraine Success Secret number 9. Today we're going to talk about brain function. Obviously, you know, if you're suffering with chronic migraines, the debilitating pain that you feel, that's a brain issue. Typically, it's the blood vessels inside the brain, but if your brain function has not been properly evaluated, that's critical. It's something that needs to be done ASAP. The issue is, if you are dealing with chronic migraines, maybe you've had an x-ray taken of your skull, or maybe you've had an MRI or a CAT scan, and that doesn't tell you anything about brain function. That tells you about brain anatomy. Now, hopefully, if you've had those tests done, they take an MRI and they say, well, we can't see anything. That's good. That's good news. That's good that you've ruled that out. But most of the time, that's not what's causing migraines. What causes migraines is a decrease in your brain function, and that's what we evaluate in our office. That's what makes our office very different. We look at two things that determine how well your brain is going to function: fuel and activation. Fuel comes in the form of the food that you're eating, glucose, and the air that you're breathing, oxygen. You need to have a good source of oxygen and a good source of glucose from the foods in order to fuel your brain properly. Secondly is activation, and you need to be moving, you need to be exercising, you need to be getting regular chiropractic adjustments. All of these things provide proper activation to the brain. And as long as your brain is receiving proper fuel and proper activation, it will function properly. And as long as we can improve upon those things, oxygen delivery, the food that you're eating, and the activation that your brain's receiving, you've got a much better hope of getting rid of these chronic migraines. First thing that we do, a cornerstone of our treatment plan, is enhanced air therapy. Once you reach the age of 25 and you pass into your 30s and 40s and on, your body decreases in its ability to carry a cell reaction called oxidative phosphorylation. We use exercise with oxygen therapy in order to enhance your body's ability to utilize the oxygen. If you're not doing that right now, your brain is probably not receiving proper oxygen supply. Next are neurotransmitters. These are the chemicals that your brain and nerves use to talk to one another. The most important one that we see in people who are suffering with migraine issues is serotonin. And we talked about this earlier in one of the other success secrets, is blood sugar. Blood sugar issues is the #1 determinator of what your serotonin levels are going to be. So if you've got blood sugar issues and your serotonin is negatively impacted as a result of that, that can cause your migraines. If you've got problems with your oxygen, your blood sugar, your activation, your oxygen delivery system, neurotransmitters, specifically serotonin, and blood sugar regulation, you will never be able to correct your migraine problems. You've got to fix all of these things. You need to call my office now. Don't suffer with another migraine. Thanks.